the United States Congress passed a law last year that changed the long-term financial outlook of major retirement programs like Medicare and Social Security. Not in a dramatic or sensational way, but in a way that affects projections about how long these programs can continue paying full benefits under current rules. According to estimates from the Congressional Budget Office, certain policy changes have reduced the expected financial cushion these programs once had. And if current laws remain unchanged over the next several years, projections suggest that Social Security could eventually face benefit reductions of roughly 20–25% once its trust fund reserves are depleted. This does not mean changes are happening immediately, and it does not mean outcomes are fixed, but it does highlight a growing gap between what the programs are scheduled to pay and the revenue they are expected to receive in the future. The people most affected by this gap are often those who depend heavily on these benefits for their daily living expenses. There is also an important detail that often gets overlooked in discussions about this issue, and understanding that detail can help you better understand how these projections might affect real households. The most important number is not just how many years are gained or lost in projections, but what those changes actually mean in practical, monthly terms. Let's begin with what actually changed. In 2025, Congress passed legislation that included a mix of tax adjustments and targeted relief measures. One part of that policy introduced or expanded tax deductions for older Americans, including some relief related to Social Security income. For many retirees, this type of change can reduce their tax burden in the short term, which can be helpful, especially for those on fixed incomes. However, these same changes can also affect how much revenue flows into the systems that fund Medicare and Social Security. Both programs rely on a combination of payroll taxes, income taxes, and trust fund reserves. When tax collections decrease without a corresponding increase in funding elsewhere, it can accelerate the timeline at which trust fund reserves are used up. This is one of the reasons updated projections have shifted in recent reports. In April 2026, the Congressional Budget Office released updated estimates about Medicare's financial outlook. According to those projections, the Medicare Hospital Insurance Trust Fund, which supports Medicare Part A, is expected to face funding pressure earlier than previously estimated if no changes are made. Medicare Part A is the portion of the program that covers inpatient hospital care, skilled nursing facility stays after a hospital visit, hospice services, and certain home health care services. These are essential benefits, especially for older adults dealing with serious health conditions. Earlier projections had suggested a longer timeline before the trust fund might face depletion, but newer estimates indicate that the timeline could be somewhat shorter. This does not mean the program will stop functioning. Instead, it means that once reserves are depleted, the program would rely more heavily on incoming revenue. Under current law, Medicare cannot operate in the same way as programs that can run ongoing deficits. If funding becomes constrained, adjustments in payments to healthcare providers could occur unless Congress steps in with policy changes. Even relatively small percentage adjustments can have meaningful effects because of the type of services involved. Hospital care, rehabilitation, and end-of-life care are not optional expenses. They are often necessary and time-sensitive, which is why the financial health of this part of Medicare is closely watched by policymakers and analysts. Now let's turn to Social Security, which has a separate trust fund and a different timeline. Current projections suggest that the Social Security Retirement Trust Fund could face depletion in the early 2030s if no legislative changes are made. After that point, the program would continue to receive payroll tax revenue, but it may only be able to pay a portion of scheduled benefits. Most estimates suggest that around 75–80% of benefits could still be paid based on ongoing revenue. To understand what that means in everyday terms, consider a simple example. If someone is currently receiving $2,000 per month in Social Security benefits, a reduction of around 20–25% would lower that monthly payment by several $100s. This would not be a one-time adjustment. It would continue each year unless changes are made to restore full funding. For households that rely heavily on Social Security as their primary source of income, even a moderate reduction can require significant adjustments to spending. It is important to understand how this mechanism works, because this is where many explanations become confusing. These projected reductions are not future policy decisions that will necessarily be debated at the last minute. Instead, they are a result of how current law is structured. If the trust fund reserves reach zero and no legislative action is taken, the program is limited to paying benefits based on incoming revenue. However, this does not mean that reductions are inevitable or that nothing can be done. Congress has several options available to address these funding gaps before they become critical. Policymakers can choose to adjust tax rates, increase or remove the cap on taxable earnings, modify how benefits are calculated, or allocate additional funding from other sources. In practice, solutions often involve a combination of these approaches. There is also historical precedent for action. In 1983, Social Security faced a similar funding challenge, and Congress passed bipartisan reforms to stabilize the program. Those changes included adjustments to payroll taxes and the retirement age, among other measures. The system has continued to operate since then, which shows that while challenges can arise, they can also be addressed through policy decisions. For individuals, the most important question is what these projections mean for personal financial planning. If you are already receiving Social Security benefits, your current payments are not changing today. The program continues to operate with existing reserves and incoming contributions. However, being aware of long-term projections can help you make more informed decisions about savings, spending, and retirement timing. If you are approaching retirement, decisions about when to claim Social Security benefits can be influenced by these projections. Delaying benefits can increase the monthly amount you receive, which may provide more flexibility depending on your overall financial situation. At the same time, the impact of any future adjustment depends on your total financial picture, including savings, pensions, and other income sources. For those who are younger, these timelines may feel far away, but they are still relevant. Financial experts often point out that individuals in their 50s and early 60s today could be among those most directly affected if no policy changes are made, because they are closer to retirement and may have less time to adjust their plans. Understanding the situation early allows for better preparation over time. Another important point is that these projections are based on current law and current assumptions. Economic growth, workforce changes, immigration patterns, and policy decisions can all influence how these projections evolve in the future. That means the situation is not fixed, and updates are released regularly as new data becomes available. One practical step you can take is to stay informed. Following updates from reliable, nonpartisan sources can help you understand how these programs are evolving. You can also review your own financial plan periodically to make sure it reflects realistic expectations about retirement income. For some people, that may mean increasing savings, diversifying income sources, or adjusting retirement timelines. Another step is civic engagement. These programs are shaped by public policy, and elected officials ultimately decide how to address funding challenges. Sharing your perspective with representatives can be one way to stay involved in the process. While individual actions may seem small, public awareness plays a role in how priorities are set. The key takeaway is that Medicare and Social Security are facing long-term financial challenges under current projections. But those challenges are not unexpected or unmanageable. They are the result of demographic trends, economic factors, and policy decisions that have developed over time. With thoughtful planning and informed decision-making, both at the policy level and the individual level, these challenges can be addressed. Rather than viewing this issue with alarm, it is more useful to approach it with awareness. Understanding how the system works, what the projections mean, and what options exist allows you to make better decisions for your own situation. These programs remain a central part of retirement planning for millions of people, and staying informed is one of the most effective ways to prepare for the future. If you found this explanation helpful and want more clear, fact-based discussions about retirement planning, Medicare, Social Security, and related policy issues, please subscribe to the Senior Wellness Hub channel and like this video. Your support helps us continue creating straightforward, unbiased content that helps seniors and their families make better informed decisions.